If he got COVID again, that would just end his life, unfortunately.
The doctor told us that.
My grandmother's home, once filled with life and love, now being emptied as she's living in a long-term care home, also known as a CHSLD. But I'm not alone. Ana-Maria Fonseca's family did the same just weeks ago, packing up their father's belongings. While thankful for the care he's receiving, they worry he'll be infected with COVID-19 again, as cases are on the rise in Quebec's long-term care homes. The latest COVID data from April 24th showed over 1,700 active cases in CHSLDs.
I'm going to be a little sentimental, but when I was leaving his apartment, I was seeing his belonging that let's say he didn't need anymore on the street, and then just driving off with my car, that was it. This is it.
From Buenos Aires, Argentina, Daniel Fonseca arrived to Montreal in the early 90s. He was a baker all his life. But in the last year, he suffered 2 strokes, getting COVID-19 during his 3 months in hospital. Now, at 65 years old, he's been transferred to Montreal's CHSLD de la Petite Patrie.
We're always like, is he okay? Is he sneezing? Is he coughing? Is he his lung? Is he breathing well? Like, we're always, COVID is something that it's very, very, we worry a lot about COVID.
More than 4,000 seniors lost their lives in public residences during the first wave of the pandemic in Quebec. And though numbers of infections and hospitalizations are increasing in this 6th wave, Dr. Sophie Zhang says so far it's not spreading as fast as it was during Montreal's 5th wave.
In the territory where I work, we have 17 CHSLDs in the CIUS Centre-Sud, and we saw that the death rate was about 4.4% in the 5th wave, compared to 40% in the 1st wave. So we do see a decrease with every successive wave.
We've done a reasonably good job of vaccinating, that group. If you break it down by age and look across the province, it's the older segments of the population that have the higher proportions of 3rd doses, and now even a very small proportion of 4th doses. So we are doing what we can, but they still have those fundamental risk factors of age and other comorbidities against them, facing this increasingly transmissible virus.
Dr. Zhang says they are seeing promising signs that the death rates in CHSLDs due to COVID-19 are lower than previously, but still calls for vigilance, something the Fonseca sisters are happy to do, spending every moment they can with their father in his new home.
It's not an easy situation, but at least they're very kind people, good people for him, for all the others persons here. They give them hope. So we're going to stick to that.
In Montreal, Pamela Pagano, City News.